You're still watching News Desk with me, Bernice Abubeidulansa. Government has been engaging researchers across the country towards consolidating various studies conducted on the coronavirus pandemic. This follows recent spike in the country's active cases, raising fears of a possible second wave. We are learning there's an influx of cases in major health facilities across the country, with some of them being severe. Greater Accra Regional Secretary of the Ghana Medical Association, Dr. Winfred Baah, talks about the situation at the Korle-Bu Teaching Hospital.
I told you about a month ago when I was on duty at the COVID center. We had to even close down some of our wards because we didn't have enough cases. And at the FIVES, we had only 3 cases when I was on duty about a month ago. Now, the FIVES unit is, our center there is full, and the wards we have closed, we now have to reopen them. We are seeing a lot of cases, even on the wards now. They are not presenting what we call atypically. Most of them will not come with cough, maybe some weird neurological symptoms. And then you test and then becomes. So we have some of the wards when we have positive cases. We didn't suspect them initially, but later on you have to do, something triggered it, and you do it, and they become positive. Then we have to move them to the treatment center. So we are seeing increasing cases now, at least from Korle-Bu.
But that isn't necessarily into deaths, right? I mean, are we not seeing that impact on fatality?
Yes, so currently, I think we've had just about 2 deaths, but those were people who were very sick. Some of them had some cancer, so we can't attribute all to COVID.
Okay.
Well, that's the situation at the Korle-Bu Teaching Hospital. Let's check on one of the country's biggest treatment centers, the University of Ghana Medical Center. Head of the ICU and National Coordinating Member for Severe and Critical Cases, Dr. Chris Owu, joins me via Zoom. Thank you for your time this morning, Doc. So do these new figures we are recording reflect what you're dealing with at your facility?
Good morning, and good morning to your viewers. Let me say that, as Dr. Baah just indicated, at the end of September, there was a significant reduction in number of cases, both new cases and then severe and critical cases. As we have kept saying, one of the important things is to know how to resource and repurpose our human resources for this pandemic, because it looks like it's going to take a while. So there were changes that were made in making sure that we do not spread ourselves thin, and therefore Korle-Bu Teaching Hospital Medical ICU, the decision was to actually concentrate our care for severe and critical in the ICU in Korle-Bu, but to be in preparedness to basically expand care if we end up having a potential second wave, as it looks like we're having now. So the University of Ghana Medical Center, ICU, the Guy East Municipal Hospital ICU, because the staff who were there were Korle-Bu Teaching Hospital, mainly Korle-Bu Teaching Hospital staff who were repurposed to assist with care in those centers. We relocated them back to Korle-Bu to assist in the Korle-Bu Teaching Hospital efforts. As it stands now, with the numbers going up, including severe and critical cases, especially in the last 2 weeks, and we anticipate that is going to continue in that direction. We are in the process, actually I'm in a meeting just before you called me, where we are basically reactivating those other centers, and that would include the Greater Accra Regional Hospital, the new infectious disease center in Baah East, and then, if need be, the intensive care units in University of Ghana Medical Center. Yes, so that is a situation at the moment. But as we keep saying, this virus is only defeated by following the prevention protocols that we've reiterated many times: swearing, physical distancing, and your hand hygiene. And as long as we do not continue to follow this, we're going to have difficulty, because our resources are not infinite. We have difficulty
Doc,
in dealing with.
Doc, is your facility full now?
No, that is exactly what I was explaining, that we had to re-strategize because we do not have, we still have limited human capacity to spread around.
Okay.
So we concentrated in Korle-Bu Teaching Hospital. The intensive care unit in Korle-Bu Teaching Hospital, as of this morning, we filled the last bed. And that is why I said the strategy is to continue to open up more spaces in those other centers. We are expecting to roll in the new infectious disease center where we have 21 critical care beds within the next 1 week. But again, the problem is not just number of beds, it's human resources. And critical care human resources are limited in our country. It is a resource that we need to be mindful that even if we have 1,000 critical care beds, we're not going to be able to man 1,000 critical care beds. We do not have enough critical care practitioners, both doctors, nurses, and other cadre of staff. If we have similar to what we had at the end of June and in the middle of July earlier this year. So as a country, we actually have to make sure that we do not get back to that situation again.
Doc, are you able to tell us if there are any persons on ventilators?
So currently, there is one person on ventilator, but not intubated. We have different modes of ventilating people. Yes, there is one person on ventilator.
Okay, and do you have, you mentioned human resource, but do you have enough PPEs considering the numbers that we are recording daily now?
Yeah, so with respect to PPEs at the moment, that is not a big problem. But of course, it is, again, at the beginning of a potential second wave. If we have the numbers escalate, we may need a lot more. And let us be mindful that our PPEs, majority of the PPEs are imported from other countries. And these are the countries that are having a full-blown second wave at the moment. Just as we had at the beginning, where we had difficulty in bringing in PPEs, because those other countries needed them for their own patients. We may run into that difficulty again. So we've planned, we've stocked, and we are hopeful that if we contain, if we prevent the spread, that what we have at the moment should not be a big problem. But of course, if we have a full-blown second wave, we would get into resource difficulties, challenges.
Grateful for your time, Dr. Obu, and we wish you and your team all the best as you help us deal with this virus. That was head of the ICU and National Coordinating Member for Severe and Critical Cases of COVID-19, Dr. Chris Obu.